In today's KX conversation, we're focusing on cardiovascular health.
In honor of American Heart Month, we've invited a doctor to speak with us about the importance of getting your heart screened. Dr. Nayan Desai, thank you for being here.
Yeah, thanks for having me. My name is Nayan Desai, and I'm an interventional cardiologist at Sanford Health in Bismarck.
Now, Dr. Desai, can you talk to us first a little bit about what a heart screening is and what exactly is being looked for when someone has a heart screening done?
Sure. So heart screen is a screening method to kind of help prevent heart diseases and identify individuals who are at risk for developing heart events. And the way we do it at our program here in Sanford Bismarck is anybody who is between the ages of 40 to 75 years and wanted to get a heart screen can contact our clinic, and then we go through a couple of criterias in terms of, they are being seen by a clinic nurse. We check their blood pressure, check their cholesterol numbers, also check their blood sugar, and put all that in a score. And if a score kind of tells us that we need to be proceeding to the next step, then we do something called as a calcium score test. And that is done with a CT scan. So essentially takes about 5 minutes. There is no IV or contrast with that study. And you go under a CT scanner, and it helps us to identify if there is plaque in the arteries of the heart. And that's a very powerful method endorsed by all the guidelines like the American Heart Association and the American Society of Cardiology in terms of identifying people who have risk to develop heart diseases, be that, family risk factors, personal history, and some of the other measures which we use to kind of determine that.
Sure. And typically, doctor, do you usually see someone after a major heart event or more as a preventative measure?
This is more a preventative measure. If somebody has had a stent, or if somebody has had heart disease, or they are being followed by their heart doctor, then for those kind of individuals, I would recommend to check in with their doctor first. A heart screen would not be recommended from them because we typically are checking their blood pressure, their heart rate, their cholesterol numbers on the blood work. And if they have a stent, we would not want to do a heart screen calcium score because it would make the numbers go off.
And Dr. Desai, apart from heart screenings, what are some things people can do to stay heart healthy?
Yeah, so it comes down to kind of, the modifiable risk factors, avoiding smoking, complete smoking cessation, trying to limit processed food in their diet. If they are diabetic, controlling their blood sugars, controlling their blood pressure, and more importantly, some amount of physical activity every day. I would say at least 30 minutes of physical activity 5 days a week.
Dr. Desai, we appreciate your time. Thank you so much for being here.
Well, thank you.